Hello and welcome. My name is KVG and I'm your hostess. Now, today is International Day Against Drug Abuse and Illicit Trafficking, and Cimas IGO, in partnership with Highlands Wellness Group, are launching an anti drug and substance abuse campaign under the theme It's Never Too Late. Say No to Drugs. Now, this campaign seeks to give hope that life after drugs is indeed possible. Now, on my panel today, I would like to start by introducing the good doctor, Dr. S.M. Chirisa, Cimas Healthcare Services, General Manager, as well as psychiatrist. It's good to have you, sir.
Good morning, KGV.
Thank you so much. Tinashe, the lovely Tinashe, sitting next to the doctor, Tinashe Katikiti, Highlands Wellness Group, General Manager and clinical psychologist. Tinashe, welcome to the panel.
Thank you.
And sitting right next to me, Tariro Saimano, and she is the Cimas IGO wellness coach. It's good to have you.
Thank you so much, KVG.
Fantastic. Now, as we kickstart our discussion today, I would also like to welcome everyone who is in the audience today and those that are receiving us live remotely. Now, you can feel free to comment and send through questions as we kickstart our discussion for today. Now, by raising your hand, I would like to find out if you have a relative who is a drug addict. You can just raise your hand if you have a relative who's a drug addict, a friend who is a drug addict, a colleague. Like I said, this is something that we need to take seriously and have a discussion that can maybe change the situation that we are facing in the country right now. Now, maybe we start with definition of terms and getting to understand what addiction is. Maybe I'll kickstart the conversation with you, Dr. Chirisa. What is addiction?
So, addiction is when an individual can no longer survive or live without drugs or the need of drugs. And that addiction is divided into two different types. There is what is called physical addiction and psychological addiction. So, physical addiction happens when your biological systems no longer can function normally without the presence or in an environment which is drug free. So that's why you find it's so difficult for somebody who's on drugs to just leave them, because you'll then have withdrawals and things like that. Then psychological has to do with you are now psychologically, you now need it for you to function, even though your body doesn't need it. But your psychology, your emotions say, I need to take it in order for me to perform. So, in layman's terms, that's what you would say. That's what addiction is.
Thank you so much, Doc. Tanashi, how best would you describe or break it down for us?
Okay, I would say in summary, it's a medical condition, which is important to note. Like Dr. Chirisa said here, it takes over your brain. So there are brain processes that are involved, and it's continued use of substances despite knowing that they're bad for you. So sometimes you actually know this is not good for me. I need to stop. I want to stop. But because it's taken over your brain is now telling you otherwise. And you cannot stop due to the withdrawal symptoms and so forth. And it basically takes over your life. If you're not taking the drugs, you're thinking about them or planning of taking them or recovering from taking drugs. And that's addiction.
Thank you so much, Tanashi. Tari, would you like to add?
I think they've really summed it up very well. Just to add on, it definitely is a chronic illness. The person will take psychoactive substances or drugs. They are both legal and illegal substances that people take to get to that state of addiction. It's important to note that there is a very big change in terms of mood, in terms of emotional processing, in terms of thought processes, all of these things would definitely affect the behaviors that are going to be more evident in society. That is when we can say this person has an addiction problem.
All right. Now, Tinashe, what are some of the common substances that are abused right here in Zimbabwe?
Okay, I would summarize those into three basic groups. You've got your central nervous system stimulants, which are your cocaines, crystal meth. Then you've got depressants like your marijuana, alcohol. Then hallucinogens, which affect your perception. People hallucinate and you start seeing and hearing things that are not there. And we can also classify them into illicit drugs, which are the most common things that people are quick to think about when you say drugs of abuse. Your illicit drugs are your illegal ones. Like I mentioned, marijuana, cocaine, and them. And then we've got medicinal drugs as well, prescription drugs, different reasons why people end up using them, but people are abusing your painkillers as basic as Stopain, your pethidines, your diazepams, and some of the drugs that we're actually using in psychiatry for treatment are also being abused. Then you've got your seemingly very innocent substances, your coffee, which are stimulants, caffeine. Then you've got alcohol, sold over the counter, a bit of restriction there by age, then nicotine as well. And smoking cigarettes is actually one of the most difficult addictions to get over, to recover from.
Well, thank you so much, Tinashe. Now, when we get into the streets, we hear terms like mtoriro, goka, and I would like to understand that doma wama substances that are being abused by young people. So maybe let's talk about mtoriro, goka. What is that?
So Mutoriro, also called Guka Makafela, Dombo, Ice, Rock, and all these terms on the streets, it's a substance called methamphetamine, which is a stimulant. And it makes someone more alert, more energetic, and all those things. And the problem with crystal meth now, which is the very popular term, is that people also ask who takes substances. It ranges across the spectrum society wise, starting from the very bottom, you've got your Bronclear, which will be very cheap, $3 a bottle. In the middle, your marijuana, people from all sorts, all walks of life use it. Cocaine on the other end of the spectrum, very expensive, but highly potent as well, very strong, difficult to get over, 80 to 100 US dollars per gram. Then comes Mutoriro, very, very potent like cocaine, but costs very little. That's why it's causing so much damage because of the strength, its intensity, plus the access and affordability.
So, what symptoms can we tell or read on a person that is abusing toriro or goka or dombo?
Okay. The symptoms he'll add after I comment. Some of the symptoms from Gukamakafela and Mutoriro, in other words, we're looking at people take it for the euphoria, basically, but it causes a surge in energy, alertness. People are taking it because it increases the confidence, motivation to do things. It even increases your libido. So people are taking it for confidence in that area as well. But it comes with negative side effects now. You're not eating, you're not sleeping, which is one of the drivers people take it as well for that long term insomnia. You're not eating and things like that. You end up with meth mouth, where your teeth start cracking and breaking. It ages you because you're not eating. It's destroying your tissues and vessels. So, yeah.
Yeah. Now, Doc, what are some of the negative effects that are associated with drug and substance abuse? Just picking from what Tinashe was saying.
All right. So all drugs, when you abuse them, it means that you are using them not in the way that they are supposed to be used or never to be used. And what then happens is that it destroys, and you can actually categorize the destruction and the impact into social factors. So it will destroy families. You will see, depending with the age, people will have social problems, relationship problems. You can go to academics, depending, with one of the things that you actually see is that it starts to impact, performance in school. Grades start to come down because you can't concentrate, and you can't keep up, you know. So people actually don't actually go to school. So especially when you're dealing with university students, one of the symptoms that I see with my patients is that they just stop going to school. Parents will be paying, there are no results, and they'll come and tell you all sorts of things that ma results anakuya, kune zvaitika kucomputer yakrasha. They'll come up with all sorts, and amazingly, parents believe it. And for 2 years, they don't see any transcript, no result, and they're still paying. And the guy is actually using that money to fund, so it destroys trusts. It destroys. We also see accidents. A few weeks ago, one of my patient, young lady, was involved in an accident. And when you did the drug test, there was cocaine, there was crystal meth, and was practically drunk. And so people die. People injure innocent people. We also see a lot of crime happening while people are in drugs. We also see a lot of, rape or sexual assault on young girls, young women. We also see a lot of diseases, HIV, because it destroys your judgment. So you unengongone ginger ungweta anything, and you don't use condoms. You don't look at what is happening. You just do it, And so it actually destroys every aspect of your life, every dimension of wellness, which I go sort of like preaches and talks about. Drugs will literally destroy each level, from your finances, which is from your social, from your spiritual life, from your academic, from it actually destroys every part of your life. I'll give you a casing example and maybe stop there. There was one guy who had inherited, young guy, 32, inherited 3 houses in the northern suburbs worth 750. In 3 years, used cocaine and was now living in a shack. Used 750,000 US dollars worth of inheritance due to drugs.
Well, that is sad, but it is a reality. And thank you so much for that, Doc. Now, I would like to believe that everyone who's joining us here knows that you carry a double cap as a psychiatrist, as a man of God. And I know that there's a misconception around drugs. Mwana akaita madrugs zvinogona kunzi mweya wemadzinza. What's your take on that?
I will actually comment, because a week ago, I was at a church gathering. We were actually launching a response. And what had happened was that a son of a pastor who had started using drugs, the pastor took it into his hands, locked the guy in a room and said, "You are not leaving, you are not doing anything." And in 2 days, the guy hanged himself in that house. So what I want to say is that there's a lot of stigma which actually prevents people from seeking help. And it has to do with our explanation of things that we don't understand. And in our culture, when we don't understand anything, we always attribute it to spirits, we always attribute it to mamepo. And unfortunately, whether you're Christian or you're traditionalist, your narrative concerning anything you don't understand is the same. It's all spiritual, and you can call it all you want, demons, mamepo, ngozi, and all that. Okay? Now, as a pastor, I know that those things do exist. But also as a medical doctor, we also know that addiction is a medical problem, and it's a brain problem. It's a brain disease.
Can we pray for it?
So, in the school of medicine, we use what is called evidence-based medicine. If you claim that Sangamidzi can heal HIV, We will say, fine, we'll give you 100 people with HIV and say, we're going to give you 6 months or 2 years, whatever you claim, and we're going to come and retest them. So what we have seen is, while praying, we actually use it as psychological support. It's part of the treatment process for those in that belief system. So I am a Christian. It's my belief system. But I've got patients that are Muslims who don't pray to the same God. I've got people that are traditionalists, but when they come to me, they're coming to me to be helped on their condition. I don't impose my spiritual beliefs on them. Neither do they expose or impose their spiritual beliefs. So what we do, I allow people in their belief systems to believe what they want to believe. It's your choice. We can use your belief system as a way of supportive care. But what I want to say is that we in medicine, we know, and we've got the science to know what happens when you take drugs, how you become addicted, and how we can rewind. That's why we say rehabilitation. How we can unwind that coil to make you back again. And we can do it without praying. We can do it without any religion. But when somebody is religious, we use that as a support system. So I want to say it categorically that while there are different, there are spirits, tribal spirits that make certain things run in families and things like that. But when it comes to drugs, it can start on its own. There is no witchcraft involved. It's people who made decisions, started a wrong thing. They thought they were in control, lost control, and now are in trouble. And those people need to be rescued.
Well, that's the hashtag. It's never too late. Say no to drugs. And this discussion powered by our friends from Cimas IGO. Now I'll come to you, Tari, and maybe you can pick up from where the doc left off. Some of these misconceptions, myths around drug and substance abuse.
Thank you so much, KVG. So, when we are dealing with people recovering from addiction, we get to see and gather a lot of information from the family and friends. So, I think the biggest misconception that I've come across is that you can spot someone who's addicted in the street in a crowd. That's a myth. Addiction affects even highly professional people. They perform well in their work areas. They blend well within their communities, but are actually battling with addiction. So it is a myth that only people who are in the streets, who are stuck, we call it kustika. It's a myth that is only people who are found in the dirtiest parts of the city are the ones who are suffering from addiction. People who are professional are also suffering from addiction. People who are happily married are also suffering from addiction. So we want to debug that myth as we are launching this campaign, that it's not just what we think. We do not want to push stereotypes when we're dealing with addiction, because once we do that, we are actually stigmatizing against, and we're actually propagating the addiction in itself. So that's just one myth I've come across.
Tinashe?
Picking up from what she was saying, some of the myths on the streets, you have people using terms like kutsomwa, tsomtsom.
Yes.
It's actual.
Yeah.
It's actually a medical condition where in English we say paranoia. Munar kutsomwa, people are after me, take this and that. What's happening? Paranoia. So people are also promoting things that are actually not right at the same time. Then in terms of cultures and so forth, we still have a long way to go. Like you were saying, we tend to spiritualize a lot of things, whatever we don't understand. And the unfortunate bit is by the time people come to us, they've tried so many other avenues and over a long period of time. But what's actually happening? The disease is progressing. By the time they come to us, things are out of hand. What does that cause in the end? People then associate mental health, psychiatry with very dramatic things. because people are leaving things to the last minute when things are really bad. That's what we tend to see with our eyes. Yet a lot of us are walking with minor conditions that could be controllable over time on an outpatient basis, just like someone is on hypertension medication. You can attend to these things before they progress. That sekuru, which we say is the life of the party. You go to a Christmas party, those fun people. What are we doing? Nurturing the illness over time. Only when they're now psychotic, we run to
And can they be
medical
saved?
services. Early enough, which is why we're preaching early intervention. So, yeah.
All right. Thank you so much for joining us. And like I said, if you are receiving us remotely, you can feel free to send questions and comments. And it is powered by Cimas IGO as we are launching this amazing campaign. Now, what are some of the treatment options available in Zimbabwe and how can one access them? So we've noticed, yes, mwana ari kustika, mwana hachadya, mwana ari kupera miri, some of the symptoms that you were describing earlier. Toita say, how do we go about it?
So, yes, now you've discovered your child is not eating or they're aggressive, they're now violent, and all that. To start with, we said it's a medical condition. Go to the right place to get treatment. Treatment for substance use, rehabilitation, usually two-pronged. There's the medical side to it, where we're doing detoxification, basically clearing your body out of these toxins. We're also using medication to treat to manage withdrawal symptoms at the same time. Important to know, a lot of people who've got substance issues have other psychiatric conditions that come with them: schizophrenia, bipolar, and depression, and so forth, which also require medical treatment. So there's usually treatment of comorbidities that are there. Then, after the detoxification, which is the first part of treatment, we then talk about therapy. We work with clinical psychologists. So the medical side is taken care of by the psychiatrists. We use a very multifaceted team: clinical psychologists, psychiatrists, occupational therapists. The psychiatrists are the ones managing the medication, therapy done by psychologists, where we're now dealing with the psychological addiction. He mentioned physical addiction, psychological addiction, behavioral change is what we're driving at. To learn new habits, remove the old, and that's the most difficult part. Then occupational therapists as well are involved to get someone back to a functional person. Planning, goal setting, social skills, and all those things for someone to be functional.
Yeah. And maybe, Doc, you can pick up from Tinashe from the psychological to the physical.
Okay. So I think what is important for everybody to understand that the addiction or substance abuse is a spectrum. So we've got people that are at introduction stage. They still need help. They need intervention. And those can be easily intervened without even being admitted. They need counseling to look at what is the drivers for them to use the drugs. Some of the drugs, people are using them for what I call self-medication. They've got anxiety, they've got stress, they've got other things, and then they're using a negative coping mechanism, which is the drug. So at that time, you can then help them with the issues that they're actually trying to deal with when they are using the what? The drug. So it's early. But then we've got people that have now been using it for some time and you continue to use. You are now getting into your secondary or tertiary, where you are now a full-blown addiction or addict, to a particular substance or particular substances, which is what we sometimes see, that people can actually be addicted to multiple substances. So those ones are then the ones that we are dealing with at a tertiary level. We are now dealing at an individual and say, what is Number one, we do drug tests and say, what is your drug profile? What substances are you using? And we have seen the ranges starting from all. We have seen somebody with cocaine, crystal meth, cannabis, alcohol, everything. The whole range is there. Then we see somebody who's just using cocaine. And they'll be taking pride in themselves. I just use cocaine and Martin Torero. And, as if it's any better. You get what I'm saying?
It once.
I tried it. It wasn't cool for me. And at one time, somebody was just using Bronco. Said, I use Bronco only, well, just Bronco. But you can get addicted to that because the substances within those cough mixtures is almost the same as the one that in heroin. We call it opiates. So it's actually pretty dangerous. And so depending on the level of or where a person is on the spectrum, the interventions differ. And at the early part of the interventions is to deal and say, what are the drivers? Deal with the stressors that are there, and also just psychoeducating. And because some people actually think that these things are cool or they will not cause harm. At the other end of the spectrum, you actually need to admit. For example, alcohol. Somebody who has been drinking alcohol for 10 years, you try to make that person stop, you can actually kill the person. Withdrawals from alcohol, 5 to 10% of the people, if done without not under medical help, can actually make the person die. It can actually end up being a medical emergency. So it needs to be done correctly. Even when you are withdrawing from things like stop pen, I had one patient who was using 30 stop pens per day. When we tried to stop, he went into a withdrawal of opiates. And what happens at that point is that you run everything. You've got nose running, you are sweating, you have got diarrhea. We actually had to readmit that patient into a hospital to rehydrate. So you can't just say stop. You actually need medical care. So there's a medical part to it. There is a psychological part to the treatment. There is a social part to the treatment. And that social part involving the friends, involving the relationships, the parents, the siblings, because that person at that point needs everybody to support. So you'll find that it's a holistic approach. It cannot be a lonely support. And that's what Highlands Halfway House has done. It has brought all these and put up a program that is able to intervene, especially at the extreme end. But we can also intervene even at the end where we have seen patients come to us who were at schools. I'm sure there's those schools that we saw at the beginning of the year this year. Some of the parents brought their kids to us, and we realized that these kids were not addicted. They had used, and we had a primary care intervention to stop that and to help that. It's still treatment, but it depends at what spectrum a person is.
That's powerful. Thank you so much, Doc. And yes, I was about to come to you, Tari, because you're a wellness coach. And I think Doc was just highlighting the issue of getting everyone involved, right? Because I would like to believe that, sometimes, when a drug and substance abuser relapses, it discourages everyone around, everyone who's been trying to help. Adzokera futhi kuma drugs kuya. So how can we preach patience, especially to the support system, the wife, maybe it's the brother, you was mentioning siblings, colleagues. How can we try and make sure that they are well supported, and if someone relapses, ngatidzokere futhi tishinge naye?
Thank you. When we're dealing with rehabilitation of people recovering from addiction, it's not just focused on the individual. We always make sure that the family is our other patient. So it's very important to go step by step with them to explain the process. So as a wellness coach, education is one of our biggest things. We want to educate the family on what is going on. We believe that once we know what we are facing and how to deal with it, it's almost half the problem gone. So we make sure that we are very open about what addiction is, scientifically, what is happening to your beloved. And then we go on to the steps on how is it going to go about. We also want to look at all the dimensions of wellness. There are all 8 of them. We are looking at the physical, spiritual, social, occupational. In as much as we want to focus on our client, we must remember that the family is going through a myriad of issues also. Probably the affected person has been stealing, and mom and dad are at wit's end because they have to buy everything new. Their finances are not doing okay. Socially, they are not being respected anymore because of what this person has does. So as done. So as wellness coaches, we want to make sure that all the dimensions of wellness of our clients on both sides are well taken care of. So as Cimas IGO, we say when you're on the Cimas medical aid plan, even when your beloved one is going through something and needs addiction recovery, the parents, the family can come to us for wellness coaching. We can actually go through the process of recovering what it is that has been lost from the family side, while also at the side, at Highlands Halfway House and the places the patient is getting enough therapy, enough medication that they need to recover. So this is what we can do for our clients.
Yes.
Yeah, just to add to on the families. So you'll realize when we're doing treatment, we actually also require the family to come in. We'll start with family sessions, call you in between, call you towards the end for a discharge plan, for example. Why are we doing that? Sometimes the family or parents' parenting style can be feeding into the problem. They can be contributing and driving the problem. Sometimes family are victims. Because of the problem this one is going through, everyone is affected, everyone suffers. If you look at something like systemic therapy, the one person who's presenting with illness for treatment right now could be a symptom of a problem in the entire family. Yeah. So it's good to look at the entire unit. Then maybe just to close on the treatment. So in terms of where to go, like we're saying, it's very medical, psychiatric, physical, dependent, psychological, social. We've got the Highlands Wellness Group there. The first private psychiatric hospitals in the country opened as Highlands Halfway House, then subsequently opening Borodo Halfway House and Mandara Manor. So we are providing that holistic treatment there for substances, recovery, and all other kinds of psychiatric illnesses, which I said can affect everyone as well. It's very distributed across the entire population. Prices differ. You find where you fit in as well, depending on your requirements, standard, how critically ill someone is as well. Those are some of the factors that will determine where to go. So you can visit, I'm sure, click on the links and you'll see more about us.
KJ, can I just add on the treatment, especially socially? One of the things that you find is that when somebody is using drugs, they actually are an emotional drain to the people that are around them, being at work or even the family, wife or husband. And we call it, people can actually, become fed up in layman terms with a person. I'll give you a case in point. I've got a patient, one of my patients a few years ago, who, while in the state of drunkenness, said all the F words to the father. And so now the father doesn't want to talk to him. The mother is now depressed because the family is breaking down. The father is saying, he did this to me. I don't want to see him. I've disowned him. And when I started to speak to the father is also in pain that he has got no relationship with his son, even though he's angry. So you can see that it's an interconnected of social pain. So while you are dealing with the physical aspects or the physical problems to the individual, to his body, to his brain, you've got this myriad problems socially. And if those are not addressed, when you discharge a patient into that dysfunctional environment, it will not do them good. So you need to be dealing them both. That's why we say that it's wider than just dealing with an individual. You have to deal with the social problems. You have to deal with the financial problems that are at hand and that will be developing. And they will be at different. People would have fought. People would have said hurtful things, and people are bent out. People would have said, "I will never, never," and that never, never person is the one who's bringing and is paying. Because most of the time, the one who is actually has got the problem might not have the capacity even to pay or to bring themselves to treatment. And sometimes also, what we have seen is that somebody who is using drugs might not be in a cognitive capacity to understand that they need help. Everybody else needs help. And we are happy that in this country, you can actually bring those people, even without consent, to treatment centers at Harare Hospital, and they can actually be brought, because some of them will actually be a danger to themselves, will be a danger to others. So there are points where you can talk to a person to come. But when somebody becomes a danger to themselves, at that point, it is the responsibility of the society and the relatives to get that person help, because he is not in a framework of mind to make that decision for themselves.
Powerful. Yes. Tinashe.
I've got an example which will show you how the cultural, the access to funding, who's taking care of you. We had someone come in desperate for treatment, quite psychotic, but they knew they had a problem, they need treatment. We're talking to them and so forth. An hour or two later, the father and the husband arrive coming after, so they were literally trailing behind. I'm sure makambosanganawo nezvamakasangana nazvo kumhuri kwenyu. Tauya uzombotorawo mwana wedu kuti timbonoita sei, timbofamba. So you can imagine what then happens to the person. Imimi mune kwamunobva, isusu tine kwatinobvawo. Makambosangana nezvenyu, isi tine zvatakaonawo.
How do you fight that? How do you win that? I mean, Doc, how do you deal with such a situation?
The only way we can start dealing with treatment barriers is to deal with the stigma. Because you see, when somebody why some people who are having drug problems or abuse problems don't come for treatment is because if they come, they fear to be stigmatized as psychotic. But psychotic is another thing, and you can be psychotic without drugs. But drugs can also initiate or trigger a psychotic event. So people, because they don't want to be associated with psychosis, they actually don't seek treatment. But one of the things that we actually do is when somebody comes to us, we look and say, is this person psychotic? Or we call it a pure substance abuse problem, which means that he knows what he's doing. There are no psychosis. He's just abusing the drug. But there are some people who come in and they are breaking windows. They are saying they are seeing things, and that person is psychotic. So while you are treating, before you even go to the rehab, you have to first treat the what? The psychosis. Because you cannot rehabilitate a person who does not have cognitive hold of themselves. So you have to bring them back to normal, and then you can start to deal with the issue. The only way to deal with stigma and as a barrier of treatment is education. Programs like this, going to everybody and normalizing mental health conversations, which we haven't done so well as a community, especially in the Black community. The white and Caucasian community in our country, most of them, they talk about this. You hear them, I'm on Prozac, I'm on this, and they are cool with it. But us, we are like, everybody's just underground suffering. And we're saying, it's time to normalize this conversation. And sometimes we hide people that have got pain, and we perpetuate suffering. In fact, not just perpetuate, we actually trigger suffering because certain things are actually easily dealt with early. But because we don't, we end up dealing with a monster of substance abuse. But we need to have that conversation. KVJ, you need to have and to host more of these and your talk shows. Let's really talk about the things and normal until it's easy for people to just walk in and say, I've got depression, I've got anxiety. Just like people said, "Ndine BP young." Who does anybody say, everyone has ndine sugar, or ndine BP, or ndine makumba, ndine arthritis. People are like proud good ndine arthritis. But if you ever seen anybody say ndine depression, everybody, because we don't communicate. And we are saying it's time for us to normalize the mental health conversation, because a lot of people are suffering by just keeping quiet and trying to cover it. And by the time you want to deal with it, instead of dealing with a lizard, you are dealing with an alligator. And that's where the problem is.
That is so true, Doc. And someone said to me, kuti, isuse vanhu vatema chinhu chatakatya kunyara. Hatidi kunyara.
Sure.
It's true.
Hatinyadzisa. Kana kuti mwana wavo akaiswa muchipatara chevanhu vanopenga. You know. So I think, like you're saying, we need to start the conversation, and the conversation is starting now, right here with our friends from Cimas in partnership with Highlands Wellness Group, and we hope that this conversation will change a lot of lives and perceptions as well. Now we're talking about rehabilitation, and before I open up, this conversation or rather discussion to our audience, Tari, I just wanted to find out from you, life after rehabilitation. What needs to happen?
So during the rehabilitative process, there are structures, there are routines and habits that people are trained in. There are social skills that are instilled in our patients whilst they're still in rehabilitation. So when they go back home, it's really about trying to maintain and to bolster the skills that have been learned through rehabilitation process. So the first thing that we need to be looking at to bolster is family support. The family needs to support this person. And how does the family do this? By also being aware of what is going on, also being emotionally aware of what their relative, their beloved one has been through. So the family needs to be very also sensitive, not to be too judgmental, but to be accepting and to be embracive and supportive during that time. There's also a need to communicate continuously with the rehabilitation center as well, because there are also programs on how to take care of them. So people are not just dropped. It's a process, because addiction in itself is a chronic illness. It's a chronic illness. So it needs that constant support and constant care. So also there's very, very important to maintain a good physical fitness schedule. Very important to consult dietitians. Very important to always have that relationship with professionals who can help in stress management, professionals who can help in planning a good meal when you are now at home, professionals who can help you come up with a good fitness plan and strategy as you find your way back up in society. So these are some of the things that can actually be done with Cimas IGO. We have a team of coaches as well. We've got fitness coach, we've got wellness coaches, and we also have the dietitians as well. All these people are there to offer this service for people who are now at home and need to regain their place in society.
Our discussion powered by Cimas IGO in partnership with our friends from Highlands Wellness Group. And I will take this opportunity to open the discussion to my audience. If you have any questions for my panelist. Yes, Tinashe, as we wait for someone to ask a question.
Okay, just to add on to life after rehab, it touches on a very common question we have. So does rehabilitation work? A mistake that many people make is we come to rehab, we expect an instant solution, we're done. It's largely a jump start. Like she's saying, it's a chronic illness, very long term. You come, someone is equipped, you're detoxed, you're given a second chance to start on a clean slate, you're equipped with all these things. Many factors play a part in recovery. What have you been taking? For how long? How much damage had been done before you came in for treatment? Then, subsequent to rehab, are you coming back for your reviews? We've done this intense program. After that, come back to see your psychiatrist, come back to see your psychologist, your occupational therapist, family support, like she mentioned, environmental changes, even in the home. Where are you going back to after we release you from rehab? Very important, because people will refer to someone who didn't get support and say, this doesn't work. But BP uyo and the other person, vesevane BP, they're completely different people. So it's what you put into it, how willing you are to change, and the effort. I don't know if you want to change before to add, sorry.
Okay. Yeah. So I would tell you, and I want to give examples. We had one patient that came to us 4 times before they ended up being free. So we call it cycles.
Yeah.
You know, there are people who do well with one cycle. You give them, and they will do well. And we are looking at almost 60% of patients. But the other 40%, they are at the different struggles. So there will be relapse. There is no program in the world, whether in Zimbabwe, South Africa, the moon, or wherever, or Mars, where a person will just, which gives you 100% guarantee. But what I can say is, it's probably one of your best options you've got to give you, the capacity and the platform to actually recover. So we don't give up. Once everybody comes, some, when they come, they are brought in by their parents, but they have not made a decision. But the second time, I saw one person who said, last time they forced me, but this time I came on my own. I really want it to happen. So that level of motivation is very key. That's why one of the things that we do is to deal with motivation, and we've got psychological ways called motivational interviewing that we do to bring the person to want to change. Because you can bring somebody to a donkey to the river, but it will not drink. So motivation is very key, and our job is to foster that. So yes, and so the discharge plan is very key. That follow up is very key. Most people just come once, they disappear, and we see them coming back after 2 years with, it was okay for 6 months, it was okay for, then something happened. But so those follow-throughs are very key, and we've got programs that we do as we discharge people. Yeah,
Fantastic. Thank you, Doc. Tinashe, okay.
And to also acknowledge different levels of success. People have abstinence in mind, that's the ultimate goal. But encourage the person, acknowledge reduction in use after rehab, changes in the social environment, your relationships are better. Someone is now more functional. Whereas before they came in for rehab, they were lying down all day, every day. Now they're able to go to work, they're productive. Encourage all those small steps on the way until we get to the final goal that we want to get it to as
Yeah.
success.
Thank you so much, Tinashe. And I see there's someone in the audience with a question. Kindly share your name and go ahead with your contribution.
My name is Alan. Thank you, KFG. Thank you, Cimas IGO team. So my question was, if I'm a non-Cimas member, how do I access these rehabilitation services?
Right.
Okay. We've got a toll-free number that we're giving out together with this program, this campaign that we're making, that we're doing. Please feel free to contact that toll-free number. They will direct you whether you need IGO services now, whether you need treatment, to see a wellness coach. People do get we do give support to non-CMAS members as well. You will be referred by your general practitioner and get treatment.
Fantastic. Thank you so much, Tinashe. And I'm sure we will be dropping details in the caption there so that you can get in touch with us. And don't forget to follow us on social media. That's Cimas IGO as well, so that you can find out more information. Another question? Please go ahead. Your name and you may proceed.
Hello, my name is Tendai. I'm from Batrapangwe. Thank you, Doc, for actually appreciating how mental health is really not prioritized and appreciated, especially in the African context. Also realizing that when it comes to rehabilitation, it's a model that we actually adopted from the Western and Eastern world. And mostly the recommendation is 90 days. But we are trying as much as possible to actually contextualize the treatment models. So what message would you put out there to the people who actually advocate or rather who embrace the 90-day program, when yet most of the people, I'll give reference to Zimbabwe, most cases you can confirm your patients might be their first point of contact with the mental health facility, whereby you have to actually address some of the underlying schemas which took a lot of years to actually build up, but the patient expects to be treated and rehabilitated within 90-day programs. So what message would you relay and put out to the people on the duration of the programs?
Okay, thank you. That's a good question. So there is no hard and fast rule on the number of days. There are 14-day programs, 28 days program, 60-day program, 6 months, 12 years, 5 years. I think what's important is to understand at which, remember I said that addiction is a spectrum. So there's no need to take somebody who is at introduction stage for 12 months program because they are not at that level. You understand what I'm saying? So the most important thing is to assess each individual, because now what we are now doing when we are doing rehabilitation, we call it tertiary care. You are focusing on the individual. It's different from public health where you are just educating everybody and so you are now dealing with an individual and look at what are their issues, what were their drivers to use, what were they using, what were the levels that they were using at, what medical problems they have now, because some will have liver problems, kidney problems, health problems. So you have to deal with all those, and so people differ. And so we differentiate the length of time based on the personal need of a person. What we are trying to do is, because private rehabilitation, it's expensive. It's not a cheap thing. So what you want to do is you want to take, so our model that we have, we are doing in Zimbabwe, because we are in a resource constraint settings. We say you come in for an intensive period. Then the rest is now done while you are in at home in the society, so that it will not be a big financial burden for you. But what we are trying to do is, in that intensive, we are trying to look at the problems that are there: physical, psychological, financial, the family problems, bring the people together, educate them. So it's quite high intense, but it's not enough. So 28 days that Cimas covers is not enough. That's why there's that follow-up outpatient care that is continuing for the next 6 months, but we are trying to manage the cost, but ensuring that people get. So it's not a hard and fast rule that you must have 90 days or 60 days or what days. It's more like, what is the need of the person? And what we actually, some people will need more than the 6 months follow-up. But what you are doing is you want to help as many people within that framework of time that you've got, and catch those you can. But the most important thing when it comes to drugs is not to start them at the beginning. Don't go that road, because some people say, "I'll just try cocaine once." Now, what you need to say, that might be it. So our message is, don't try. What we are now trying to do is to rescue people that are already in the fire. But the message is, don't go into the fire in the first place.
Don't go into the fire. And for those that are in the fire, we're saying it's never too late. Say no to drugs. And like I say, this discussion powered by our friends from Cimas IGO and Highlands Wellness Group. I'll take another question.
Thank you very much, Tim. My name is Tenley. I just want to ask Doc one question. This drug abuse thing, is it not going to affect future generations? Because you talked something about sexuality and the like. Are we not likely to be getting sort of deformed children, if I may put it that way, in layman's language? Thank you.
Right.
I can take this one.
You can take this one.
Yes.
Okay, please go ahead.
I think the shocking statistic that we need to know that is that there was a time when research was showing that drug abuse was amongst young men. So it was from about 20 years going upwards, the most productive age of a male. But research is actually showing currently that children as young as 9 actually starting to be addicted. So that statistic has changed. So we are looking now at younger and younger people who are indulging. So what is the effect of this? This actually has got a national implication. It's a crisis. Number one, you're saying the younger that they start on drugs, the harder it is to be weaned off when they get to addiction. So the quicker, the more riskier it is for them to be addicted. The second thing is once they are on that habit, are they going to go to school? Are they going to perform well? No, they are not. So what does that imply? They are getting older, right? So that means even the productivity stage of their lives are going to be negatively impacted. So this is for the young males. Now we are going to the females. They are also as young as 14 who are taking the drugs now. What are the implications for the young females? We've got early marriages. We've got a surge in sexually transmitted illnesses. We've got promiscuity, just general carelessness because of the impaired judgment and cognition that comes with it. So it's actually a national crisis. The younger they are starting now, the more difficult it is for us to have responsible and productive adults in the future generations. So it really is not too late to stop right now. Those who are in it, the teenagers, we want them to stop so that they can get back what they've lost so far. And for those ones who are being initiated, currently, the older kids, what they do, they engage the younger ones. The ECD, who goes to looking into the bag of an ECD child? No one. But they're the mules. They're the new mules now. So once you are a mule, once you are a transit point, it's easy for you to be taken in there. So it really needs an extra amount of attention in intentional parenting. Taking care of the younger ones now. It has to be more intentional. It has to be more present as we are parenting these younger children, so that we can get to that point where the older generations, the older that they get, they are more responsible.
Thank you so much for that, Tari. Tanasha, you wanted to add?
I was going to say something in those lines as well, but I'll just add that the human brain only gets fully developed by about as late as 25.
Yeah.
And given that kids are now starting so early, you're already starting to interfere with a brain that is not even fully developed. So it's already going this way instead of that way. And only that people start to see the discrepancies when you're in your early adulthood, 20s, 30s, you're now comparing with your peers. My classmates are now married, settled, they've got nice jobs, a car, a house, this and that. What have I done? What has my child done? Due to those comparisons, you start now to wake up. Yet you've been seeing little telltale signs along the way. We ignore it thinking this is adolescence. Maybe they're just experimenting, they'll grow out of it, and so forth. So don't ignore all those things along the way.
Fantastic. Thank you so much. And maybe one more question or two.
Thank you, KVG. So I just wanted to ask, I do have a relative who is on drugs and they are addicted. What are the steps that I should take towards their rehabilitation? And how do I deal with relapse?
Thank you for that question. So, the good news is that if you are a Cimas member, Cimas now covers in full inpatient drug and alcohol rehabilitation. It's a first among medical funders in Zimbabwe. And that's why they've partnered with, that's why we have partnered with Highlands Wellness Group to ensure that that happens. And so if you are a Cimas member or your child is a Cimas member, what you need to do is to go to your, you can either come to IGO or you can go to any Cimas medical facility. Then you'll be referred to the Highlands Wellness Group. That includes Highlands Halfway House, Borodo Halfway House, and Mandara Manor. However, the Mandara Manor, because it's a high-end one, there are shortfalls, even if you are on Cimas, both the US dollar packages, because it's a hotel look. The other one are functional, it's fully covered. And so if your relative is not on Cimas, is on other medical aids. Other medical aids have also started to join in, but we have to know which ones. Some have, not all of them have got that are covering yet, but Cimas is the only one which we know is full. If your relative is cash paying, you can go to any according to your affordability. And like I said, the Highlands Wellness are privately owned, and so there is a price to it. If your relative does not have money at all but still needs help, then we urge you to go to government facilities. Harare Hospital, Paranyatu Hospital, Ingucheni, Ngomahuru, all these, they've got facilities where people are actually treated for free. But it's government. So you need to understand the limitations and the advantages of that. But that's how I would go. And the rest will be discussed once you are in a facility.
Fantastic. Thank you so much, Doc. And I'll take one more question right at the back. Your name, and you can go ahead with your contribution.
My name is Tadiwa. So one of the main reasons people take drugs is because of peer pressure and because of the influence of friends. So how can you advise someone not to be lured back into such a negative environment? That's my question for you, Doc.
All right. So
Yeah, I think it's a very difficult one, because I think also when we're having this discussion, I was thinking after rehabilitation, you're not going back into the community, and these drugs are being sold in dark corners, so you can't really then identify the supplier. What if I then make my first encounter with the person who was supplying me drugs before I went into my 90 days of rehabilitation? So I think that's also another loophole, somewhere that we really need to touch on, Dr. Nashintari, and see how we can fix that.
I would say, listening to that question, first issue is the causes, looking at the causes of substances. Where, like you said, there's peer pressure, someone is in the wrong place at the wrong time, experimenting at adolescence. Then there are people who are using it to deal with traumas, to get over stressors. There's idleness, having nothing to do, and things like that. So in treatment now, which is why someone comes in, will ask, when did you start? What are you using? Why did you start? What makes you continue taking them? And we equip you with the right therapy to deal with that. For some, Dr. Chirisa mentioned motivational interviewing, which is motivation to commit and to want to stop taking the substances. We've got cognitive behavioral therapy, which also deals with correcting incorrect thoughts associated with use of substances. So we can equip you with dealing with stressors better in life. If whatever made you take them was to happen again, what are you going to do? That's when we train you healthier coping mechanisms, and then environmental changes.
okay, ladies first.
Thank you, Doc. So peer pressure is quite rampant in our young generation. You will notice that peer pressure is coming as a result of being idle. The rate of unemployment in our country is rampant. However, that's not the only issue. What happened to our community centers? What happened? People went and started planting maize meal in community fields where there was supposed to be something for the youth to do. So what can we do about this? As IGO, we are trying to roll out fitness centers around the suburbs of this city so that youth can get a place to go and exercise. One, they are working on their health. Secondly, it's a productive way of using our time. And when they are there, they can actually interact with other youth from everywhere, and they can make some healthy connections in those spaces. So peer pressure, I hope they can pressure each other into uptaking such services that are going to be free for Cimas members.
So one of the things that I wanted just to say is that when you are now discharging a patient back to the community, you've got a clear discharge plan. And also, when somebody is in rehab, it's unfortunate that there are lots of rehabs coming up. And some of them are just holding centers. People just going there and they are just, the gate is closed, but nothing is happening. It's unfortunate because the purpose of rehab is to train and to give that individual tools that will make them be able to survive in the outside world. Okay, so what we actually do in our rehab is we go through what is called assertive, ness training to make you assertive, to be able to speak up and say no. We actually do role playing where you say this is a drug dealer. What do you say when you meet him? Because you can never execute what you have never practiced. If you have never said no, on the day where you are required to say no, you can't say it because you've never said it before. So while you are in rehab, we actually take every day, we are doing role playing where you are practicing so that on that day you can say, no, I'm going home, I'm going what? So you actually role play so that when you are out there, it becomes your second nature. So what we actually need, so we are actually preparing that person to actually do well. And one of the things that we actually do is we do what is called a friends analysis. We actually say, tell us your friends. Who are they? Their age, their sex, their residence, occupation, what they do, hierarch them in terms of who is your best, who do you spend most of your time with, and we look at that and say, who should you be when you get out of this place? Who should be your friend? Who should you not play with? What are your relapse prevention strategies? So it's very clear. So when somebody is coming out of that program, they've got very clear executable plans. It's not just say, or just find yourself. So what we need to understand is proper rehab has to do with skills training and upskilling the skills of that person and emotional intelligence of that person to be able to deal. Because right now, there's no space without drugs. Drugs are everywhere. They're like oxygen. You can find drugs anywhere. So you can't say you're going to have a drug-free place. Drugs are everywhere. So you have to train the person to survive in a negative environment. So you have to upskill their emotional skill, their physical skill, and their training. And you train them while they are still in rehab. That's what we are actually doing. Over to you.
Fantastic.
Yeah.
As we commemorate International Day Against Drug and Illicit Trafficking, this discussion was powered by our friends from Cimas and Highlands Wellness Group. Thank you so much to my panelists. Can we just give them a round of applause for this wealth of information? And hopefully we can save and change lives. And don't forget to click the like button and also share this discussion so that it can reach to that person who is waiting to hear everything that we were talking about today. Closing remarks, I'll start with you, Tari.
Thank you. Compassion and empathy are the two most important things when we are dealing with our relatives and friends who are recovering from addiction. That's all I have to say.
Thank you so much, Tari. Tanashi?
My closing remarks will be, it can happen to anyone, including all of us sitting in here. So yes, let's not be afraid to step out, to acknowledge where there's a problem, go out and get the necessary help. The sooner you do it, the better it will save a life. Because usually we say no one ever starts taking substances with the ultimate worst case scenario in mind. But yes, it can happen.
My words is that let's not lose hope. No matter how bad a person is or can be, there is always help. And what we need to do is to present them to people that are committed to helping them. Whether it's your son, it's your father. I've had patients that come in at 75 years and they're saying, you know what, I need help. So let's not give up on anybody. We are not leaving any man behind. So let's come, use the facility Cimas is given, especially to Cimas members and all the others. Come and get help. Do not give up on your loved one. Thank you.
Fantastic. And from Cimas in partnership with Highlands Wellness Group, we're saying it's never too late. Say no to drugs. That's it for today. My name is KVG Ndirimwano Edangwe, and thank you so much for watching.